Children under the age of 16 are not included in Australia's vaccination targets, even though there has been an increase in young Australians contracting the Delta variant of coronavirus. Professor Robert Booy is an infectious diseases specialist at the University of Sydney, and he joins us now for more. Good evening to you.
Good evening.
Do you know why children aren't being included so far as part of the vaccination targets? We continue to hear talk about both the 70 and 80% threshold for double doses of this vaccine, bringing us greater freedoms, fewer lockdowns. But at that point, very few children will have been vaccinated.
Well, children are special. They're very resistant to COVID. They tend to get no infection symptoms or mild symptoms, occasionally hospitalised, and death is very, very uncommon in children from COVID. So we need to prioritise the at-risk populations who are likely to die from COVID, people in their 50s, 60s and 70s, teachers in their 20s, 30s and 40s. Get the teachers done, and then we'll get the kids done later. Of course, children may develop occasional severe disease, but honestly, they don't get it very often at all. And also, the Doherty report indicated that were we to vaccinate 12 to 15-year-olds in the hope of preventing transmission in the community, it would make little impact. We really need to get the 20 to 39-year-olds vaccinated first, and then later on, perhaps at the end of the year, early next year, we can think about children.
The Chief Medical Officer, Paul Kelly, this week has called the Delta variant in Australia a pandemic of the unvaccinated. What happens if, for instance, in New South Wales, we continue to see local transmission when the economy does become freer, when restrictions are scrapped and we are told that our lockdown is effectively ending? Do you think children will face an increasing risk from the Delta variant?
Well, the Delta variant is into children, it's into teenagers, adults, the elderly. It's just adapted very well to the human throat and nose, and therefore it can spread very easily, whatever your age. Children, because they're not vaccinated, will probably get more disease. But as I've said already, they get it mildly. The issue is to get the people who are likely to die vaccinated first. The herd immunity that we all seek, with 80% of people over 16 being vaccinated, that will make a big difference. Even if it doesn't stop it in its tracks, our outbreaks will be small, they'll be short-lived, and they'll have few deaths associated. So 80% will be a real ticket. And even before then, 70%, we may yet have good levels of control being achieved at just 70% vaccine uptake. It's rapidly increasing, and I can see us getting to our targets really well in October, November.
We are, though, seeing reports of some children in hospital, particularly in Queensland, where we have seen that outbreak in a few schools. Is Delta actually presenting as a more severe type of this virus than what we have seen with the Alpha and the initial variants?
Well, it's still the same in Australia as it was a few months ago. About 1,000 people, all adults, have died, not one child. In the United Kingdom, 25 children have died compared with over 100,000 adults. In the United States, 400 children have died compared with 600,000 adults. Of course, children can get it severely, but they do so much more rarely than adults do.
Now, we've been talking about when children may get vaccinated, and the TGA has approved a vaccine for children aged 12 and above. Do you think there will be a vaccination in the next 12 months or so for children aged under 12?
Oh, certainly possible. The studies with Pfizer, which have already had approval for 12 to 15-year-olds, especially for those at risk. And I emphasise that 12 to 15-year-olds could be vaccinated quite soon if they have a chronic medical problem, a neurological like cerebral palsy, immunological, heart or lung problems. Those kids can get COVID severely. They're in the minority. Most of the 25 deaths in the UK were kids with predisposing conditions. So we will have vaccines for younger children under 12. The studies should be completed within the next couple of months, and I can see it being approved later this year and implemented early next year.
Professor Robert Booy, could I just finally get your assessment of where New South Wales is right now. Do you think it could possibly regain control of this Delta outbreak before the population reaches that 80% threshold of double dose vaccinations?
Well, as other people have said, including Casey, we are in the fight of our lives at the moment. It looks as if we're really struggling to get on top, and we're going to need wider and deeper restrictions and lockdown. I think we can get there. I've always said that. I just think it's going to be a tough road, and it'll take some time. We are still the envy of Europe. They look at us and say, why are you in lockdown? We've got thousands of cases and we're not in lockdown. So there's different ways of approaching this. I think we're going to keep our hospitals functioning really well the way we're going at the moment.
You just said that we do need wider, deeper restrictions. We continue to hear from the New South Wales Premier that New South Wales is indeed experiencing the harshest lockdown that Australia has seen. How do you think the restrictions can be tightened further?
Well, very clearly what's already happening. We need to see the impact of more LGAs going into full lockdown, more country areas where there are cases being locked down for a week and then released. New measures are being taken all the time, and we need to see the impact of that after 5 to 7 days. It hasn't been a happy road. The figures just keep going up, but I still have seen other countries in our situation that have gotten out of it. It's a tough road. We can do it.
Infectious diseases specialist Professor Robert Booy, thank you.
You're welcome.